we are going to do a little quick fire round about the topic of relapses. And my first question, do all relapses need steroids?
No.
Can relapses cause permanent damage?
It can, and some people can be left with residual symptoms, but many people fully recover.
And can stress trigger a relapse?
It can increase the risk, and managing stress is important, but it doesn't directly cause a relapse.
If symptoms come and go quickly, is it still a relapse?
Symptoms need to last at least 24 hours to be classed as a relapse and be 30 days clear of your previous relapse.
What is the biggest myth around MS relapses?
Steroids cure a relapse and are always needed, and any worsening of symptoms means a relapse.
Hello and welcome to MS Trust podcast. I'm Helena.
And I'm Grace. We both work here at MS Trust, a charity that's here for the MS community, for every MS, every day.
And we're here to provide trusted information and support to help people navigate MS every day.
And we're also working to drive excellence, equity and consistency across MS treatment and care.
Plus, we're also powering research into the issues that matter most to people living with MS.
In today's episode, we're talking about something that can feel worrying, confusing and often unpredictable. MS relapses.
Many people with relapsing and remitting MS will experience relapses at some point, but knowing exactly what's happening isn't always straightforward. Is it a relapse? Is it a flare-up? What's the difference between these two things? Or are your symptoms getting worse because you're tired, stressed, overheated? I mean, we've certainly been feeling quite overheated this summer. Or could it be like an underlying infection that's causing symptoms to misbehave?
Relapses can look very different from person to person. They can involve brand new symptoms or the return of old symptoms, and often they raise a lot of questions about what to do next and whether you actually need treatment or not.
So in this episode, we'll be covering what a relapse is, how to recognize one, when to seek help, and what treatments are available, and what recovery could look like. And we also have some tips from people with MS on how to look after yourself during a relapse.
Earlier on, Helena spoke with Kat Alexander, MS nurse, who answered some of the most common questions we hear from our community about MS relapses.
And Kat explains the difference between relapses and pseudo-relapses, when symptoms might need urgent attention, and shares some advice for anyone who's experienced a possible relapse right now.
Alongside this episode, we've recently updated our information about managing MS relapses, which you can find over on the MS Trust website. You'll find practical guidance on recognising relapse, getting support, as well as understanding all your treatment options.
And we always include links to those resources in our show notes.
So for now, let's get into the conversation with Kat Alexander.
I am now here with Kat Alexander, who is a multiple sclerosis specialist nurse, and we're going to be talking a bit about relapses. But before we start, Kat, do you mind just giving us a little introduction on who you are and what it is you do?
Yeah, of course. My name's Kat Alexander. I am an MS nurse specialist working in the southeast of Hampshire, so we cover quite a large demographic area and community-based, so seeing lots of patients or people with MS in clinic, talking to them over the phone. We do home visits, blood monitoring and all of those sorts of things. So yeah, that's a bit about me.
Busy then.
Busy, yeah.
So today we're talking about relapses, and I'm going to start at the very start and just ask, what is actually an MS relapse?
Yeah, so I think the easiest way to describe an MS relapse would be that it's an attack on the myelin sheath, which is the protective coating to the nerves that we've got. It causes new neurological symptoms that typically last more than 24 hours. I think that's the sort of simple terms of what is a relapse. It can be slightly more complicated than that in different scenarios.
That's certainly one thing that we saw when we asked our communities what they wanted to know about relapses. And I think a lot of people they hear the clinical definition, but then it's kind of hard to get your head around what it actually works like in practice.
And it's very different for everybody. So a relapse for one person wouldn't be the same as a relapse for another. So it takes a bit of unpicking, and that's what we're here for, to help with that.
There's also a lot of terminology around this, isn't there? And people use lots of different things. So we can hear relapse, we can hear flare-up, pseudo-relapse. What's the difference between these things?
Okay, so if we start with a typical relapse. So a typical relapse would be the appearance of new neurological symptoms or a significant worsening of existing symptoms. And that would be caused by new inflammation in the central nervous system. Symptoms would typically last at least 24 hours and occur without any other explanation, such as infection, fever, or any other external factors. So that would be our relapse definition. We then talk about flare-up. So a flare-up would be an informal term commonly used by both people with MS and healthcare professionals, usually describing a temporary increase in existing symptoms and often triggered by factors such as stress and fatigue and infection, which we see really quite often, and also at the moment with the hot weather, that would impact that as well. And then if we go on to sort of pseudo-relapses, a pseudo-relapse is a temporary worsening of previous MS symptoms caused by an external trigger rather than new disease activity. So common triggers can include infection, fever, hot weather, having a hot bath, overheating, stress, lack of sleep. And generally, once the trigger is removed, the symptoms resolve. So that's where it differs with a relapse, is that when you remove that trigger, the symptoms get better. Whereas with a relapse, we tend to see that those symptoms evolve over time before they improve. So with a pseudo relapse, going back to, they usually improve and there's no new inflammation or damage occurring to the nervous system. So that would be how we would define the three terms.
I think I experienced a bit of a pseudo relapse myself 2 weeks ago, because I had a sinus infection and then started getting really bad vertigo. And that is one of those symptoms that tends to sort of pop up anytime I'm not getting infections.
Yeah. And I think that's the important thing to remember, isn't it? Is getting to know your MS symptoms, getting to know what's normal for you, getting to know what your sort of usual symptoms are, and recognizing when that's okay. I've had this before. It's really hot, or I've got this infection. That might be why I'm sort of getting a bit of an exacerbation of this now. But compared to, oh, this is new for me. I've never had this before. So it's just figuring out what's normal, and the person that has MS is normally the expert in that sense.
It's tricky. I mean, I've had MS for 19 years, I think now. Is it? So you get better as you move with it, but it's very tricky to get your head around it when you're newly diagnosed, isn't it? Because you just don't know what to expect.
Absolutely. I think quite often using we'll probably talk a little bit more about this in a little while, but using a symptom diary can be quite useful. So from onset, just getting to know what your symptoms are and how they might change and what might affect how you're feeling sort of day to day or week to week, and what those triggers are for you. Because actually, like I said, we sort of mentioned at the beginning that everybody is different, and a relapse for one person would be completely different to a relapse for somebody else.
You've already mentioned 24 hours, because one of my next question here was, does symptom have to last a certain amount of time to count?
So they do. So symptoms need to last for at least 24 hours to class as a relapse. They need to be not explained by infection or any other external factor. And it needs to be at least 30 days since the last relapse as well to be able to class as a new relapse.
We can move on a little bit and talk about how to recognize a relapse then. So how can somebody tell that what their experience might be a relapse?
If someone is experiencing new symptoms or a significant worsening of old symptoms that last for more than 24 hours, that would be a time where we could consider that might be a relapse. It's important to recognize that these symptoms can occur at any time of the day or night. So you could go to bed completely fine and you could wake up in the morning with these symptoms and not been aware of it during the night. And they all vary depending on which part of the nervous system is affected as to what those symptoms might be. So I've put some common ones here, but obviously it's not limited to this, but some of the most common symptoms that we see are new numbness and tingling, new areas of weakness, changes in vision. So that could be blurred vision, double vision, loss of vision, problems with balance and coordination, changes in sensation, and significant worsening of mobility. So that's just a few of those things that could indicate that person is having a relapse.
We've already talked about this actually, but what's the difference between a relapse and something like an infection or heat-related symptoms?
So again, we probably repeat ourselves quite a lot
Yes.
during this. So I think a relapse, again, it lasts for more than 24 hours and it will continue to evolve or remain quite significant. Other symptoms would resolve once the trigger is removed. So, take away the hot weather, things will get better, take away the stress, take away the infection. So relapse is not caused by fever, infection, or overheating. A pseudo relapse is triggered by those factors, but not caused by it. A relapse would represent new inflammation within the nervous system, where a pseudo relapse would not. So yeah, we kind of touched on that, didn't we? So we typically would test for urinary tract infections, whether someone is symptomatic or not, and that it really is because a UTI can be asymptomatic and quite often can be unnoticed, and people maybe don't have symptoms and things. So so we would always check for infection, and if they'd had some recent bloods, we would maybe be looking at inflammatory markers and things like that. But yeah, that would be what I would say for that. So yeah, if there is a trigger, and once that trigger is removed, that wouldn't be a relapse. And a relapse would evolve over time.
And are there any sort of key warning signs? You've already mentioned some of the sort of symptoms that people can have, but is there anything that people shouldn't ignore if they're noticing it?
Yeah, so I think any sudden loss of vision or significant change in vision shouldn't be ignored. Where we are in the southeast, we've got a sort of local emergency eye department, which we would advise. So if we had somebody that called with, a sort of significant change to vision, we were thinking, oh, maybe this could be a relapse. The first thing we would do with them would be to advise that they went to the eye department to have their eyes checked, and they're very good down there. They're very good there. They would normally do that for us. I think another one would be this sudden weakness that affects its sort of ability to stand or walk, any difficulty speaking or swallowing, severe confusion or drowsiness. Loss of bladder or bowel function is important, and any sort of new numbness. I would also just say that it is kind of important to recognise that whilst people have MS, they can still, experience other illnesses and disease as well. So it's always important to seek medical attention if you have any of those symptoms, whether that be speaking to the MS nurse or the GP, because sometimes we need to rule out other causes of those symptoms as well, because there are other things that can cause similar symptoms. So it's just being aware of that, really.
It's very easy to want to put everything down to MS, isn't it? When you're living with it and you think that, oh, whatever is going on will probably be MS fault.
Yeah. And quite often that is the thing. That is what we see is, oh, I didn't let you know because I thought it was just my MS, and actually I think we would just say always, if something doesn't feel right, then it's always good to just talk to somebody.
I can go from my own experience on that. Last summer, I thought I was getting the MS hug. I hadn't had it for like several years, and I was getting all these like pains, kind of very neurological kind of pains around my rib cage, and then kind of just ignored it, thinking, well, it might be a pseudo relapse because it was very hot at the time, and then suddenly full with rash, and it turned out to be shingles.
Yeah. That's a good example, isn't it? There are lots of other things that can cause similar symptoms. So it's just, just being aware and contacting a healthcare professional if you've got any concerns in that sense.
I guess one thing we didn't talk about is that you can sometimes do have a relapse at the same time as you do have a cold or an infection. But
so it's not to say that you that if you do have an infection, that is definitely the cause. But what we would probably do in that situation is treat the infection first, and when that person's recovered from the infection, then we can reassess the situation. So yeah, that would be the advice. That would be the advice there, because you're right. You could be having a relapse and have an infection at the same time. So it's just about treating the infection and then monitoring to sort of see how those symptoms, and if like we talked about, if the trigger is removed, and the symptoms tend to go with when the trigger is gone. If the trigger is gone and the symptoms are still there, then contact the MS nurse and have a chat with them.
Let's talk a little bit about what you should be doing then if you think you are having a relapse. What should they do
Yeah.
first?
So I think this will really depend on the severity of the symptoms and, the time of day, whether it be the weekend. Quite often MS nurses operate on a Monday to Friday basis, so we don't operate out of hours. And I think I would always urge someone to contact their MS nurse if they think they're having a relapse. But having said that, if it was the weekend or an evening and you felt that, and someone felt that the symptoms were severe enough, then I would suggest that they would contact 111 or go attend their local emergency department to see, get advice from a healthcare professional in that sense, and then contact the MS nurse the sort of next available day that they would be there for sort of give you some advice and support there. I think when someone contacts the MS nurse, they would always ask a variety of questions. So that would, include things like when did these symptoms start? Have you had any of these symptoms before? Thinking back to, even back to when you were first diagnosed, are any of these symptoms old? Have you got any signs or symptoms of infection? Are you under any increased stress at the moment? And then obviously we can help to organise a urine test, with whether that be not quite often with us, it's with the GP surgery. We help to sort of organise that to rule out any sort of infection there. And like I mentioned before, if these symptoms are serious and your MS nurse isn't available, then you need to contact your local hospital.
Let's move on to talk a little bit about treatment. And I will mention here that we actually did a recording earlier in the year of a podcast, which was specifically looking at steroid treatment in relapses. So if people want to know more about that specific area, there is another podcast on it. But do relapses always need some sort of treatment?
So no, not all relapses need treatment. Steroids would generally only be recommended if symptoms were disabling, and careful consideration needs to be taken when it comes to prescribing high dose steroids. Steroids don't alter the outcome of or the damage that's caused by the relapse. They can help to sort of speed up recovery, but not in all instances. So we have to be really careful and really weigh up the benefits and then risks of giving steroids. And then I thought I'd just touch on a little bit of some side effects that people might see with sort of steroid treatment, which can be insomnia, sort of quite significant mood changes, those kind of peaks and troughs up and down, sometimes weight gain. That's not a limited list, and we would always counsel someone with MS on the different side effects that potentially that could occur with steroid treatment, and a sort of a PPI, which is sort of stomach lining protection, would always be prescribed to just reduce the risk of gastric irritation or any complications of that treatment. And we would always take into account the regularity of steroids. If someone had been prescribed steroids recently or within the last sort of year or two, just to kind of gauge where we're at now. So yeah, I think it's important to sort of just touch on the fact that we now have some really high efficacy treatments for MS with regards to disease modifying therapies, whereas previously we didn't have these high efficacy treatments. So steroid treatment was used quite a lot more for a treatment, whereas now we tend to not see that as much because these treatments are getting so much better at sort of controlling the inflammation and sort of preventing relapse activity from happening. So yeah, that's a really positive change.
If we're sort of stepping away from just steroids, there is sort of treatment for the different symptoms as well, I'm guessing here, if we are looking at.
Yeah, of course. So that, and again, that's all dependent on what those symptoms are. So with regards to any sort of stiffness or spasticity, then there's some specific treatment that we would look at that, and we always follow the NICE guidelines. So if you're ever you want to know about what treatments that we use for symptom management, whether it be pain, restless legs, spasticity, all of those other, we can't treat every symptom. Not every symptom can be treated, unfortunately, and sometimes symptoms can be so sporadic that actually treating them wouldn't be appropriate, because putting somebody on long-term pain medication for pain that is sporadic wouldn't necessarily be the right thing to do. And we would look at sort of more holistic ways to try to manage that pain. And that really is because, all medications unfortunately come with potential side effects and complications. So if we can keep people off of medication or with, as sort of lower level of that medication as possible to keep symptoms under control, then that's really important. And that would be how we would always sort of help counsel and talk through those sort of possible side effects and things that can happen. So yeah, symptoms can be treated, but I think that would definitely be a conversation to have with your MS team, and then obviously they would liaise with the GP, or if you've got a prescriber in your team, then they would look at prescribing something for you. But
let's talk a little bit about recovery. I mean, this is kind of asking a little bit like how long is a piece of string, but
yeah,
how long does relapses typically last?
yeah. So I think you hit the nail on the head there. So it's quite a difficult question to answer because for everybody that will be very different. Typically, I would say it would maybe last weeks. That's like a build up over sort of a few hours to maybe several days. Many people start to notice that they get an improvement after a few weeks, but recovery can continue for several months. And I think up to sort of 12 months, we would say, especially if someone came back to us and said, after maybe a few months or 6 months in, and they were still having sort of residual symptoms from that relapse, then it's really important for us to sort of counsel these people with MS to say that actually, it isn't uncommon for this to go on for sort of a longer period. And we would say until we get to that 12-month point, we don't know if those symptoms will be permanent or whether or not they will resolve.
And I guess that was my next question, because people do ask this. That's all right. You know what you're talking about. Because we do see a lot of people that will ask, like, will people recover fully?
Yeah, absolutely. And unfortunately not always. So, some people, quite a lot of people do. Some people will fully recover, whilst others will maybe notice that they are left with some persistent symptoms or a slight change in function. And that again goes back to quite often depending on whereabouts in the nervous system this new damage has occurred. So that can kind of relate back to that. They may also find that symptoms return after recovery, so even with full recovery, and again going back to sort of your pseudo relapses, so in heat, infection, in those sort of scenarios, you might find that actually those slightly newer symptoms then would reoccur at that point. So yeah, I think just to clarify, not always, but quite often people do fully recover. I'm sorry I can't give you any more clarity there, and I know it doesn't really help, but yeah, that's all I can say really.
I think that is fair, because that is what it's like, isn't it? We can't predict really what's going on there. You mentioned thinking about things holistically. So what can actually help recovery? Because we hear about, should people stay active or should they be in bed rest? How do you look after yourself while you're recovering?
Yeah, and I think again, this is one that will be what would be right for one person won't be right for somebody else. So I think a combination really is needed. So at the beginning, fatigue will likely be worse. So you'll need to allow yourself and your body to rest and give yourself a bit more downtime just to try to kind of cope with that fatigue. Anything that causes symptoms to worsen should probably be avoided. So if you start to do things and you feel that actually that makes the symptoms worse, then probably, park that for now and just try to find something else that maybe doesn't do that. As things start to improve, like gentle movement can be resumed. I think it really is kind of down to the individual and how they feel. So if somebody is an avid runner or, a gym goer or anything like that, then actually just easing back into that, once your body starts to feel a little bit better and the fatigue is kind of settled down, then yeah, absolutely getting back into a routine can be really useful. But just listening to those warning signs and listening to your body and just taking a bit of time out is always important.
Because you obviously see a lot of patients and you see a lot of people who go through relapses. What do you most hear from patients when they're sort of in the middle of a relapse? What's their comments? What are they saying?
So I think probably the most common is, how long is this going to last? And when am I going to, when am I going to get better? When can I go back to work? Is there anything I can do to speed up the recovery? What is it? Can you give me any sort of things that I should be doing? So just touching on those points. So it would be the GP that would do the sign off from work. You can self-certify for 7 days, and then the GP can sign off from that. Your MS nurse can support that if it's needed. How long will it last? I think we've touched on that. So difficult to know. Everyone is very different. It could be a week. It could be a few months. It could be up to a year. But the severity of the symptoms are generally within that sort of first few weeks to sort of a couple of months. Lifestyle is really important for recovery. So eating well, keeping yourself really hydrated, maintaining a healthy weight, exercising when you're able to and when it's safe, and as you feel that feels good for you. Not smoking is a really big one. We know that smoking has a huge impact on MS, and the progression and the speed in which that can progress, and limiting alcohol intake. So all of the things that your GP would tell anybody to do for a sort of maintaining a healthy kind of lifestyle. So yeah, all of those things. But I think the most common is, when can I go back to work? And that is very much dependent on how you're feeling, how the relapse has affected you. You could talk to your employer about a phased return if you sort of. There's quite often people want to just get back into a routine. So, most employers would support that, with a phased return, or putting any adjustments in place to help somebody to get back into work. But it's going to your company's occupational health, or that would be my advice, would be to sort of chat with them and see what they can do to help to support you going back to work.
And it's nice to know that you can also reach out to your MS nurse to
Absolutely.
sort of get some help here if you are worried with an employer that's sort of saying, well, when are you coming back?
Yeah, so we have support letters that we can send out to employers within our team. So, if you are having difficulties getting your employer on board, or getting any sort of reasonable adjustments put in place, then we can send supporting sort of letters to try and help with that, and also with the GP as well, because not always GPs don't always have a huge knowledge of MS, and that's because they have to have a huge knowledge of everything. So we can always sort of help sort of support that with the GP as well, if people are getting stuck with getting time off if they need it.
And my final question now, so if somebody's listening to this and they think that they might be having a relapse right now, what would you like to tell them?
Please get in touch with your MS nurse. That's what we're here for. We would much rather somebody phoned and said, or even if it's a silly something, if you think it's silly, there's no such thing as a silly question, or if you think you're having a relapse, we would much rather you called us than sit at home worrying about what is this, what could it be. We're here to sort of guide and counsel and talk you through it and give you that reassurance that you need at the moment. So we'll help to sort of rule out any infection. If infection isn't present and we think this is a relapse, then your MS nurse can contact your consultant and looking at steps going forward, whether that be getting an MRI scan, changing your disease modifying therapy if you're on disease modifying therapy. Obviously not everybody is. So yeah, we'd much rather you called us and just let us know rather than worrying. We're really happy and always here to help. My other thing I would say is try keeping a symptom diary and noting down any triggers. So if you've started to notice things are changing or something slightly different, make a little diary. If anything happens over a weekend or a bank holiday or outside of your MS nursing working hours, please call 111 or go to your local A&E, especially for those severe symptoms that we touched on previously. Just it's always better to be safe than and get things ruled out than it is to be worrying about it.
Thank you so much. This has been really interesting, and I think it will be really useful for people who want to learn more about relapses. Thank you, Kat.
So. That's okay, you're welcome.
Before we continue on with the Relapse podcast, I just wanted to tell you a little bit about the new challenge that we just launched. And we're very excited about this. It's a brand new fundraising challenge called Challenge 135, and it's going to be taking place throughout the month of October. It's a challenge inspired by a very powerful statistic. Every week in the UK, 135 people are diagnosed with MS. That's 135 lives changed in an instant, along with the lives of their families, friends, and loved ones. So this October, we're inviting you to take on 135 kilometers for someone you love. Whether you choose to walk, run, cycle, or swim, your goal is to complete 135 kilometers across the month of October. You might be taking part for yourself, a parent, a sibling, a partner, a friend, or a colleague living with MS. Whoever you're doing it, you'll be helping the MS Trust provide trusted information, education, and support for people with MS from the moment they're diagnosed and throughout their journey. Registration is completely free, and once you raise your first £10 in donation, we'll send you a free MS Trust Challenge 135 t-shirt to wear with pride as you complete your challenge. Raise £100 and you'll earn a fantastic Challenge 135 medal. And then for the first 50 fundraisers to reach £250, they're an exclusive Challenge 135 beanie up for grabs too. You could take part on your own, or you could get friends, family, colleagues involved to take on the challenge together as a team too. So this October, let's turn 135 into something powerful. Sign up today by visiting the MS Trust website and searching for Challenge 135. We can't wait for you to join us. Thank you.
Thank you so much to Kat for answering those questions and helping us understand MS relapses a bit better.
We also wanted to ask our MS community how they look after themselves during a relapse. So for this, we headed to our trusty MS Trust Facebook group, and there were some overarching themes here.
Yeah, there was. So many people said that the most important thing was listening to your body, slowing down, resting when needed, and not pushing through these symptoms. Several of you mentioned things like prioritising sleep and reducing expectations. For example, Charlie said, be kind to yourself, give yourself permission to pause. Being transparent about what is happening to you, masking adds to the exhaustion. There's more people out there who would willingly support you if only they knew. Recently, I put a post in my neighbourhood WhatsApp apologising that I hadn't been able to tidy my garden waste into my bin, but MS fatigue and heat tolerance had hit me hard. When I stupidly attempted the gardening in the recent heat, many didn't know, many turned up without me knowing to clear it up into my bins and theirs. Don't be embarrassed to ask for help.
I love that. I think so many people put so much pressure on themselves to try and do absolutely everything themselves. But actually, when you do ask for help, you get, quite often you get shocked how many people are willing to help. And I mean, that's the same if a friend is struggling with something and they ask you to help, quite often you will be able, if you can be able to help them, you would. So I really don't see that you have to be a hero in this. So I think that's a good piece of advice there.
Exactly.
A lot of you also talked about the importance of accepting support from family, friends, and the wider community. And like Charlie, they encourage people not to feel embarrassed about asking for help or using mobility aids and other support tools when needed. And another recurring message was that living with MS often means adjusting routines, activities, and sometimes even expectations. And people spoke about learning what works for them and accepting that sometimes things may need to be done differently during a relapse.
Exactly. And a common recommendation was also to try contact your MS team, MS nurse, or a relevant healthcare professional if any of the symptoms are new, severe, or concerning. So we also heard from Fiona, who said, try not to panic. If you recognise previous relapses, then seek the urgent help, as things like optic neuritis are time critical. Learning the best ways to access urgent care, such as going to urgent eye clinic and being met by your MS nurse to oversee your next steps in the system, is much better than waiting for a GP appointment first. Having MS nurses and neurology secretary numbers all help with smoothing any admission by not having to sit in A&E for hours.
That's another good piece of advice there. A few of you highlighted the importance of recognizing that worsening symptoms can sometimes be caused by factors like infection, illness, stress, or heat, rather than a true relapse. And Kat spoke about this in the interview as well. And people shared some examples of small adjustments that help them to manage symptoms, such as changing sleeping positions or using pillows for support, pacing activities, avoiding heat, and identifying triggers that make symptoms worse. I mean, at the time of the recording, we have had a few heat waves here in the UK, and it's, I think, a lot. We've certainly heard a lot from the MS community how they have struggled with symptoms and getting sort of flare-ups from the heat. And it's not always easy to try and, remain cool if we don't have air conditioning or we don't have, the possibilities to make the room cooler. But there is a lot of tips about things like this on the MS Trust website as well. So it's worth having a little look. Some reflected that they wished that they'd known sooner about services that can help during a recovery. For example, Tracy said, "I wish I would have known that I could request support from an occupational therapist or physiotherapist when I was diagnosed. I couldn't walk, and after 3 days of IV steroids at the hospital, they sent me home, and I could just barely walk then. I lived in a cottage with steep stairs, and it was just her and her 15-year-old child. She couldn't make a cup of tea, and because her hands were so numb, and she said, I could really have used some help and advice, and which was lucky because her parents lived in the same village, but the hospital didn't know that, and that they pretty much would have stopped without the parents' help. So again, very lucky to have, friends and family to help. But also, yes, do reach out to your MS team and sort of ask what other services there are out there. We often say on this podcast that OTs and physios are sort of unsung heroes of the MS teams, and if they can be utilized, they should, because they are great.
Exactly. And I think that just shows the importance of having such a good network around you, whether that's friends or whether it's health professionals. You really need that to feel confident in the decisions you're making about your MS.
Yeah.
Overall, we found that the general feeling was that while relapses can be frightening, practicing self-compassion and listening to your body whilst resting when you need to and accepting support when you need to, as well as allowing time to recover, all these things can help make relapses more manageable.
So a big thank you to our MS Trust Facebook group for the tips. If you would like to join the Facebook group, we'll put a link to that in the show notes as well. Or you can just head to Facebook and search for Multiple Sclerosis Trust in the groups section.
Yeah, definitely join the Facebook group if you're not in it already. It's not something to be missed. And as we wrap up today's episode, it's worth remembering that relapses can be very different from one person to another. And what's more important is understanding what's normal for you and your body and knowing when to reach out for support.
And I think one of the most reassuring things that Kat said was if you're not sure whether you're experiencing a relapse or not, to always try and reach out to your MS team. They would rather that you contacted them than not. And we do know that not everybody have an MS nurse, but in that case, try to reach out to your GP.
Exactly. And if you'd like to learn more about relapses, treatment and recovery, head to MS Trust's website where you'll find up-to-date information and practical resources.
Yes, the website has got lots of useful information, so it's well worth a visit and a bookmark. And please do check out the show notes too for other useful links.
And remember, if you've got a question about MS, whether it's about relapses or any aspect of life with MS, remember that our free helpline is here for you. You can call us on 0800 032 3839, Monday to Friday, 10 a.m. to 4 p.m, excluding bank holidays. And if it's out of hours, just leave us a message and we'll get back to you. You can also email us on helpline@mstrust.org.uk or send us a message on WhatsApp on 01462 536 008.
Yes, it's very exciting. We are now also available on WhatsApp, or the helpline is. But you can also follow the MS Trust on Facebook, YouTube, TikTok, and Instagram for updates, videos, and lots of other useful content. And don't forget, you can listen to this podcast on Spotify, Apple Podcasts, YouTube Music, and Amazon Music, or anywhere really where you would normally listen to podcasts. And the video version is also available on YouTube.
And if you enjoyed today's episode, it really helps us if you leave a rating or a quick review on your favourite podcast app. It makes a huge difference in helping more people find the show.
Thank you so much for listening, and we'll see you in the next episode. Bye for now.
Bye.